Us on the media briefing. We've got a full agenda, so let's get going with Dr. Moreno. He has an update for us for the first briefing of the year. Hi, Dr. Moreno.
Hi, Matt. Good afternoon. Hello, everyone. So my update will be similar to my update to the board of supervisors yesterday. So for those of you that heard it, it'll sound a little similar. Should sound similar, but so let me get started. As far as the where we're at with our metrics, we are still seeing an increase of the rate of, the case rate for COVID-19 is still extremely high here in Monterey County. And we continue to receive reports of cases that are coming into our county and we have a little bit of a challenge in trying to get information on a daily basis out there. And that's primarily because the state is periodically in the last week or two has been pushing some cases together in large batches, and then sometimes we can't get to the data because the state is updating the system. So just want to make people aware of that. And so when they look at our web page and looking at the rates, it looks like it's fluctuating, and that's the main reason why the last week or two the numbers have fluctuating. But we still have very high case rates here in Monterey County. Our hospital census as of a couple of days ago was 204. That's confirmed COVID-19 patients in all of our 4 hospitals. So it has it was approximately 100 in the first and second week of December, and now it's twice as high in that period over that period of time. So the rate of increase of COVID hospitalizations has increased drastically, and we're over 200 now for several days. So that's indication that there's still a lot of transmission, and the transmission is increasing. The cases are going up, and hospitalizations are also going up. So again, it's very important for in order to prevent hospitalizations with prevent illness, we have to continue to stay home and only leave our homes when we absolutely need to leave. And if we do leave, again, keep your distance. Don't gather or mingle with people that are not from your own household, and continue to wear a face covering when you leave your house. Moving on to this state health officer regional stay-at-home order. It did go into effect on December 17th, and we in the Bay Area will remain in the under the order till at least January 8th, according to the state website. The state will hopefully soon complete its assessment of the projection of our ICU capacity, and they'll do that over 4 weeks moving forward. And if they find that our ICU capacity is not going to be improving, then they will the regional stay-home order will continue to be in effect in Monterey County and in the Bay Area region. And there are four factors that the state looks at and considers in determining the ICU capacity. One is the estimated regional ICU capacity availability. Also, the measure of they have a measure of current community transmission. That's basically for every case that for every case of COVID-19, how many additional people will become infected with COVID-19. That's the way they look at transmission. They also look at our current regional case rates and also the proportion of ICU cases that are being admitted with COVID. So that's just to share with you an idea of some of the factors that the state takes into account when they're looking at our ICU bed capacity and whether or not to release a region from the regional stay-at-home order. Let's see. As far as vaccine, I'll move on to vaccine, Maya. We have here in Monterey County, we've already implemented and are vaccinating individuals in phase 1A, tier 1. Phase 1A includes healthcare personnel and individuals residing at skilled nursing facilities. So we are currently, we've already had 2 pods, points of distribution, that was primarily for healthcare personnel with fire. So those would be the EMTs and paramedics and AMR paramedics. So that we've got approximately 200 individuals vaccinated this past weekend. And we're continuing to set up new pods for that group, but also we'll be including dialysis center staff as well. We're also looking at offering vaccine to Tier 2. Again, this is still healthcare personnel. So several of our healthcare primary care clinics have already received approval from the state to receive vaccine and start administering vaccine to their personnel, their frontline staff. And so that includes our clinic, Clinic de Salud, and Doctors on Duty. We're following up with the state to check to see when other clinics will be approved, such as Soledad Medical Group and the other urgent care centers here in Monterey County. We're also looking at immunizing, beginning to immunize some community health workers and public health field staff, and also some of the behavioral health, mental health employees that are providing outpatient care and making home visits to mental health clients. They're included in Tier 2. And so as we move forward, we will continue to work with partnering agencies who have vaccinators. One important step is to get the vaccinators vaccinated. So that includes primarily, for example, medical assistants in our primary care clinics. It also includes individuals working for Visiting Nurses Association, getting them vaccinated because they're out there, they'll be out there giving vaccines, and also public health staff who've already begun to vaccinate this weekend, vaccinating the paramedics and the EMTs. And we have also been encouraged by the state of California to move on to Tier 3. As long as we're making progress with Tier 1 and Tier 2, and those strategies have been implemented underway, we don't have to vaccinate everyone in Tier 1 and Tier 2 to get to Tier 3. So we're encouraged with Tier 3. That includes especially other healthcare settings. So those working in specialty clinics, those working in laboratories and the mortuaries, those working in dental offices and other oral health clinics, and pharmacy as well. So we'll be we're in discussions on how to move forward into those tiers as well, ma'am. We're also we're not the state hasn't given us direction to specifically move into phase 1B, although the state has communicated that for those counties who have worked their way through Tier 3, those counties can begin to move into phase 1B. So one of the things that we really want to do is try to get as many people in in 1A vaccinated before we move into 1B. And the first tier in 1B will be individuals 75 and older, and individuals at risk of exposure at the work sites, such as education, childcare, emergency services, and food and ag. And we do have pretty detailed guidance on who in phase 1A should be vaccinated with tiers and additional guidance. We don't have the same type of guidance yet from the state of California for 1B, but we're hoping that we will get that soon, so that when we can begin to put more details into plans for 1B. But we are looking forward to, again, working with various sectors, the education sector, the ag sector, and ag businesses to bring resources to the employees of these sectors, in particular agriculture, that we've been able to work. We and other health organizations have already been able to work with the ag businesses for for testing, for alternative housing for isolation and quarantine. And we look forward to continuing to work with them as we move into providing much needed vaccinations. I'll stop there on the vaccine, but I can add, a few more things, man. I can share that the vaccines that we ordered last week are arriving this week, and I know that our clinic services staff have begun to receive their vaccines this week, so that's a relief. And I'm very glad that our primary care healthcare providers are beginning to get protected with the vaccine. Total, including the vaccines that are arriving this week, we have a total of 17,075 doses that have come into Monterey County, delivered here to our health department, or delivered to hospitals or primary care clinics, or urgent cares like doctors on duty. So we will be getting hopefully a final allocation soon for this week, and we'll put in another order for the allocation that the state gives to us. Pardon me, there was another clinic that received vaccines, that was Big Sur Health Clinic. And one of they have enough vaccine to vaccinate their staff, but also they're a resource for vaccinating the EMT and paramedics on the coast who need to get their vaccines if they don't come to one of our clinics to get vaccinated. And then as far as the retail pharmacy partnership, my staff told me that there are, I think, 11 of the skilled nursing facilities that have been contacted by either Walgreens or CVS, and that they are scheduling clinics now. We've been told by the state that there would be 3 clinics, one clinic for the first shot, a second clinic for the second shot, and then a third clinic for catch-up doses for anyone else that needs their second dose. So they're starting with the skilled nursing facilities, and then they will move on to the assisted living facilities after that. Let's see, and then I think I just want to share that we have been notifying those agencies that have employees, personnel that fall into the first tiers of phase 1A, and inviting them to have their staff schedule appointments for the points of distribution clinics, vaccine clinics that we've put on, and we'll continue to work through the employers. Again, phase 1A is primarily healthcare personnel who are working at agencies that where they're at risk of exposure to COVID-19. So we are working through the employers, and employers then make contact with their employees that they identify as being at risk and falling into the tiers at risk of getting exposed to COVID-19, and encouraging their employees to go to the website to schedule their appointment to get vaccinated. As we move into phase 1B and 1C, these are larger, there are some larger organizations that we will continue to work with to get their employees and their personnel signed up to get vaccinated. But there are some small organizations out there that we still are working on strategies to make the vaccine convenient for their small number of staff. And so it's one of the challenges that we have, but we are continue to, and we're still in the planning for the variety of different groups in the tiers that we're in to get vaccine out to as many people in tiers 1, 2, 3 as possible before we move on to 1B. We're also putting information on our website. So we have on our website, we have some information about the vaccine. about the vaccine clinics, about who should get vaccinated. We also have a chart, somewhat detailed chart of the different phases and the tiers and where we are in terms of getting people vaccinated in the tiers. So we're in, for example, we're in the progress of vaccinating individuals that fall under tier 1. We are in the progress of vaccinating individuals who are in tier 2, and we'll be in transition into tier 3 of 1A. And so we'll continue to update the website. So if anyone wants to see where they're at, they can, where we're at as a county in immunizing people in the various tiers, they can go to our website and get an idea of where we're at. The other recommendation I have is that if any employees feel that they fall into tier 1, 2, or 3 of phase 1A, that they contact their employer, because that we're primarily working with the employers. And so if the employer doesn't know, then I strongly encourage the employer to go to our website and look to see where they're at. And we'll be providing, continue to provide more information to employers and individuals that fall under phase 1A, so that we get as much information out there as we can. We also have been sharing some of this information of where we're at in phase 1A on social media, and we also put that out there as well. So we'll continue to do, and we'll continue to update you with the briefings, and also update the Board of Supervisors at their public meetings as to where we're at with vaccinations, which phase we're in, which tier we're in, which groups we've been able to reach, and which groups we're planning on reaching in the near future. So that's my update for today, ma'am.
Thank you, Dr. Moreno. We had a question, a clarification of a number that you provided, doses that we have received so far. Was the number that you gave 17,075?
Yes, 17,075. Those are total doses that are allocated Monterey County. That means that that includes the orders that we put in last Thursday. Whether or not they've arrived this week, those are dedicated to us now. So we'll put in an order when we get a final allocation number. We'll be putting our order by end of business day this Thursday.
Thank you. And we've got someone with an unmuted phone. If you're not speaking, could you mute your phone, because it's making it hard for the rest of us to hear. Thanks very much. So we're going to go ahead and start with some of the questions. As a reminder, we only have Dr. Moreno until a little before 12:30, so we only have a little under 10 minutes. So we'll try to get through as many questions for him as we can. So Dr. Moreno, let's get started. Here's our first question for you. Monterey County residents are eager to know when they will be immunized, but are getting little information regarding timelines. Would the health department consider issuing weekly press releases announcing which segments of the population would be vaccinated that week, or who should expect to be vaccinated the next week, and offer a weekly tally of those who have already been vaccinated in the county?
Yeah, so thank you, ma'am. So so my goal is to inform the media every Wednesday of where we're at, and share that on our county website. And the media, of course, you're all a tremendously important resource for updates for the public. So anything that the media can do to share this information, and also direct the general public to our website where they can look to see where we're at, I would very much be appreciated. In terms of tallies of who's been vaccinated, we're looking into we'll be looking into the CARE, or California Immunization Registry system, to see if there's a way to be able to get some information that's reliable, that depicts how many people have gotten vaccinated here in Monterey County. So that's something we're definitely want to look into, and that would be hopefully a good measure of who's been vaccinated. That information, though, we'll have to determine how reliable it is, because it is entirely dependent upon the vaccinators putting the individual's information into the system. So if there will also need to be following up with anyone who's vaccinating to make sure that they're using the care system so we get as reliable data as possible.
Thank you. Another question, is Monterey County preparing to take patients from San Benito County if that county gets to crisis care levels based on the new California health officer order to transfer patients?
I don't know. I can't speak on behalf of the hospitals where they're at. I just know that that there is a new order out. Thank you for that question. That order does allow the health officer, state health officer, to take action to preserve as much of the ICU available ICU capacity as possible. The intent there, as those of you who've read it, you can see that the state health officer, after determining that a region and county have the region has no capacity and a county has very little capacity left, that the health officer can require that certain elective surgeries be postponed so that hospital bed availability, to retain and preserve hospital and ICU availability for patients who are very sick and patients with COVID who have severe illness. That applies right now to the LA region and to the San Joaquin Valley region. It doesn't apply yet, and hopefully it will not apply here, but it doesn't apply yet here in the Monterey region. We are in a different region than San Luis Obispo. San Luis Obispo is in the Southern California region. We're in the Bay Area region, so it doesn't apply to us. But San Luis Obispo is under that order. In terms of transferring, there isn't anything that I've seen from the state that would prohibit counties, a hospital in one county in one region transferring patients to a hospital in a county in another region. I think that would be something that would have to be decided by the hospital wishing to transfer and the hospital considering accepting a patient, and also be coordinated through the medical health operations area coordinator for the two counties and the regional disaster medical health coordinator for both those regions. So there could be quite a few people involved in making those decisions. But again, I can't speak for the hospitals, and I can't speak for the emergency services agencies in our respective counties.
All right, thank you. Next question, when does the state's Bay Area region stay-at-home order expire, and is there an extension in the works, and when would we hear the state's decision?
Sure, thank you. So the state has shared that the Bay Area regional stay-at-home order is in effect at least through January 8th, and I anticipate, but I can't say for certain, that the state by the end of this week may put out a statement that explains their 4-week projection of ICU availability in this region, and based on that assessment, may again by the end of this week hopefully let us know whether or not if the regional stay-at-home order will be lifted for us in the region, or will continue. As far as how long, if it is continued, how long it will continue, I think we'll have to wait to see what the state health officer decides. But one option would be to have it continue indefinitely with periodic assessments of ICU bed, projected ICU bed capacity. So that's one possible result that we might see before the end of the week.
Thank you. And then we have time for just one more question. This question, I'm going to skip over part of it because you answered a question, you answered the part of the question about what phase of the vaccine rollout the county is in. Do you know what percentage of those eligible to vaccinate now have been vaccinated, and what is being done in the county to speed up vaccinations? Could you also tell us how the public could sign up or register or somehow participate in letting people know that they're ready to vaccinate when it's allowed?
Yeah. Yeah, I've got
Sorry, I'll throw a
2
lot at
minutes,
you there.
one at a time.
So do you know what percentage of those eligible to vaccinate now have been vaccinated?
I don't know what percentage have been vaccinated. We have, the state has estimates, I think an estimate of about 22,000 healthcare personnel in Monterey County. That doesn't include additional healthcare personnel that were added after that estimate was released, because the state has been adding more groups into the tiers since they issued their guidance. But the state estimates is at least 22,000, and we've gotten 17,000 doses delivered. I don't know at this point how many people have been vaccinated. Our epidemiologists hopefully will be able to see if they can get that information for us. So the answer at this point, I don't know what percentage have gotten vaccinated. That'll be somewhat challenging since we only have an estimate of healthcare personnel. We don't have a total number of healthcare personnel to go with, so we'll probably just use the state. But what was the next question?
And the next question is, what is being done in the county to speed up vaccinations? And then let me just throw in the other part. Is the public is anxious to find out, could they sign up? Do they register to be vaccinated? What should the public do at this point?
Okay, what can the public do? I'd say again, the public can go to the website and look to see if they where they might fit in the various phases. I think that's what the public should do. In terms of the public that are in the tiers, tier 1, 2, or 3 of 1A, again, these are basically healthcare personnel who are employed or work or provide services at various facilities and like hospitals or clinics. They should contact their employer, talk to their supervisor, and contact us or HR or someone else in their organization to find out how they're going, whether or not they fall into one of the tiers, and if they do, what information the employer has as to whether or not they are getting vaccinated, or whether or not it's time to sign up for clinics to get vaccinated, and if not, they can't. And if they don't know, if the employer doesn't know, I would encourage an employer who's in tier 1, 2, or 3 they're welcome to call for information. And what we'll be doing is we're working now on potentially additional ways for employers to get a hold of us when we're in those tiers that impact them. So we're continuing to work on ways to improve communication and ways for individuals to get information about when it's their time to get vaccinated. I'm sorry, I need to get going.
Thank you very much. I know we caught you just on the nick of, we just got to get you out of here. Thank you very much, Dr. Moreno.
All right, bye.
Bye-bye. And so now we're going to move on to our next subject, which is really positive news today, and it's really great to present that. We've been telling you about our community outreach efforts in the high impact areas, getting information about testing and preventive measures out into these areas that are really impacted by COVID-19. And so we've brought some people in who are very much part of that, and they're going to share how the project is going and what the community response has been to this boots on the ground effort. So we're going to start with Rosemary Soto from our County Administrative Office, who's going to give us an overview. And then we're going to bring in some of the people who've been out in the community, and they're going to share their story. Hi, Rosemary.
Hi, good afternoon. Hello, everybody. I'm Rosemary Soto with Monterey County. I am very pleased to introduce today a couple of our partners with Building Healthy Communities. As you learned last month, the Board of Supervisors did award a significant amount of funding of $4.9 million for the support of implementing a pilot project that would provide outreach, information, and resource connection to communities who are most impacted by the pandemic. And so with us today, we have Building Healthy Communities as one of those partners that has been providing a lot of outreach efforts since the start of the pandemic. And now with this support have been able to enhance and increase the reach that they have. So we are delighted to see and to hear about how their efforts are continuing to grow, and with this additional support, they are able to venture out into different and more innovative strategies for reaching the communities. And over the holidays, they did a very special, we should just say, just an increase in the push that they did to get out the information and education about quarantining and staying within their own households over the holidays. We knew that that was going to be a very difficult time for many of our community members, being that we're so used to getting together and celebrating the holidays together. And so these community health workers, or CHWs as we refer to them sometimes, did a lot of work of being present at the testing sites, and also getting out into the community, doing no contact, door hanging, informational distribution. So with that, I'm going to go ahead and introduce Sofia Cuentas and Adriana Santana. Adriana will be sharing her story with us in Spanish, and Sofia will be translating for us. And so I don't know if you, Sofia, maybe you want to start with an introduction of who you are and then pass it on to Adriana.
Yes. Hi, everyone. I'm Sofia Cuentas. I'm the CHW coordinator for Building Healthy Communities and Mujeres en Acción. So some of the strategies we have been using for the outreach has been, we've been at test sites. We've also been doing the door hangers, as Rosemary mentioned, and we've been doing phone banking calls. So we do follow-ups with residents to ensure that they get access to the resources that are available. And through that, we have been connecting with families and helping them stay isolated. We've also implemented a strategy where we take supplies and food to them in order for them to stay at home and stop the infection rates. So through that, we've talked to about 150 families, and we've distributed food and supplies to about 5 that didn't have any other support in their community. We've also been reaching about 300 to 350 people at the test sites per week, and we've distributed 242 door hangers. And we distributed those in the area codes 93905 and 93906, and Adriana Santana will present more on her story of how that went.
Mi nombre es Adriana Santana, soy de Mujeres en Acción y quiero compartir mi experiencia sobre la divulgación de los colgadores de puertas que puse en los apartamentos de Gavilán Plaza y las casas de madera en Salinas.
So my name is Adriana Santana from Mujeres en Acción. I want to share my experience on the outreach I did with the door hangers in Gavilán Plaza apartments and las casas de madera en Salinas.
Hemos tenido buena reacción de la comunidad. Mientras estaba poniendo los colgadores de puertas, hubo algunos residentes que me preguntaban más sobre la información que estaba dando y yo les explicaba sobre los programas que está ofreciendo, que se están ofreciendo a la comunidad.
We have had a good reaction from the community. While I was distributing the door hangers, there were residents that would come out and ask questions about the information I was handing out. I explained to them that there are resources offered by the county and community organizations. And I also explained where I can find, where they can find free COVID test and test sites.
Sí, les explicaba, por ejemplo, que hay pruebas de COVID gratis y también les decía dónde están los sitios de prueba donde pueden acudir.
Yes, so she explained where there's test sites and free test.
Se ponían contentos de saber que haya personas haciendo este tipo de divulgación, porque así podemos alcanzar a más campesinos que no saben de este tipo de recursos que ofrece nuestra comunidad.
They were glad to see that there's people doing this type of outreach, because that way we can reach more farm workers that don't know where to access these resources.
Hubo algunos residentes que me comentaban que cuando ellos salieron positivos, no supieron qué hacer. porque ellos no sabían de estos recursos y todavía no sabían. Entonces, pienso que este proyecto va a ayudar a que las personas puedan quedarse en casa y que sabiendo que tienen apoyo para que juntos podamos disminuir el contagio.
Yes, so there were residents that mentioned to her that when they tested positive, they didn't know what to do to stay home. So they feel like these resources are really gonna help the people isolate themselves and stop the spread.
La comunidad se siente agradecida de saber que hay recursos que los pueden ayudar. Gracias.
The community feels grateful that there's resources available to them. Thank you.
Thank you very much for sharing the experiences. Rosemary, do you want to step in here and talk about, this is the whole, the goal of what we were trying to do with this project.
Yes, so this was exactly the objective of the project, is to get out into the community, specifically in those census tracts that show the highest impact. And so we are following the data that is released to us. Dr. Krista Hani is definitely a lead in this work as well. And with that, we're able to communicate with our partners, such as Sophia and Adriana and other organizations with CHWs that are assigned to various parts of the county. And we can only anticipate that there will be greater growth and an increase in reach to the communities. And I think what some of the most important areas of this work is meeting the community where they are and identifying needs for rapid response to provide those services and resources so that people can isolate and also have the education about what to do when they find themselves that are directly impacted. So thank you, Adriana and Sophia. We really appreciate your contribution and your sharing your firsthand experience here today.
And before you step off the call, this is an opportunity to speak directly to people, because we have wonderful media partners with Spanish language radio and television. What could we say directly to people who may be watching about where to get assistance? And maybe Sophia or Adriana might like to give a direct message to people.
Yes, so something I can say is to not be afraid to get tested. There's resources out there where if your fear is that you won't be able to work and you won't have income, there's several resources out there that we can refer to you at test sites and we can do follow-up calls with to help you stay home. There's also 211 where we refer people to services as well.
And could you share that in Spanish as well for our media partners?
Yes, so no tengan miedo de ir a hacerse la prueba o de que no van a poder, no van a poder trabajar si salen positivos. Hay muchas ayudas que ofrecen la comunidad y el condado para asegurarse que tengan ese apoyo para quedarse en casa.
All right, thank you. And thanks for letting me just step in and ask a question.
Absolutely.
Now that when I had you here, I couldn't resist.
And then
Go ahead.
also, Adriana has been working a lot with these families that are in need, so I think it'd be good for her to also give a message. Adriana, si quiere dar un mensaje a la comunidad sobre los recursos.
Sí, quiero decirle a la comunidad que no se sientan solos, hay mucha ayuda, hay mucho apoyo y que corran la voz a sus familiares, vecinos sobre la información que estamos repartiendo. Si alguien la tiene, la comparta con los demás para que todos sepan que hay apoyo en la comunidad y que no están solos.
Yes. So she
Wonderful.
also stated that there's a lot of support out there and to spread the word to your family members, neighbors, coworkers, to let them know that there's help out there for them.
Wonderful. Thank you all very much. If there are any questions, I don't have anything in chat, but does anyone else on the call have any questions for Sophia or Adriana or Rosemary? I'm not seeing anything. So thank you all very much for sharing this information and congratulations on this great work. And then our final participant today on the briefing is Karen Smith from the Health Department. She's going to share with us kind of an update on what is happening with the testing sites. Karen, are you with us?
I am here. So, as people probably noticed around Christmas and New Year's, we had some issues at the testing sites, and that was basically staffing issues. We would have, as you can imagine, we've had people testing positive, and so then you have a team that has to be quarantined, and then we have another team that comes in. Given what's happening all over the state of California and the world, staffing is a little bit thin, so sometimes those things will happen. We're starting to, as soon as we know about it, post it on the website, post it on social media, that the place is closed. And then Optum, who is the vendor that handles these testing sites, will call people to reschedule. So right now, all 4 sites are open in Castroville, Seaside, Salinas, and Soledad, and we're still encouraging people to get tested.
All right, thank you very much. Are there any questions for Karen on testing sites? I'm not seeing anything in chat and
I have a
not.
question, Maya.
Super, thank
Sorry.
you. Thank you, Pam.
So are the people doing the testing, are they getting vaccinated currently?
They will be getting vaccinated.
All right,
You know when?
Karen, do we have a tentative time for when the vaccinators will get the vaccine?
I believe they're in the next tier, so shortly. I don't have an exact time.
I was asking about testers, the people conducting the tests
Yeah.
when they're getting vaccinated.
Sorry. So Karen, the answer is the same, that they're in the next tier?
Yeah.
All right, and then a question for you, Karen, also that came in, are there any pop-up sites in the works?
I believe there's some in the works, but I don't have a place yet. So just keep an
More
eye
to
out.
come. All right.
More to
All
come.
right, and any other questions for Karen? All right, then that will wrap up our briefing for today. Thanks very much for joining us, and we'll see you next week.